Folks on the right are losing their minds over just the thought of vaccine passports. For all the outrage, you'd think that this was on President Biden's agenda, but it's not.
The government is not now, nor will we be supporting a system that requires Americans to carry a credential.
So far, just one state has offered this type of credential, New York State's Excelsior Pass. Joining me now is Laurie Garrett, science contributor and author of The Coming Plague, and Dr. Ezekiel Emanuel, former Obama White House health policy advisor and author of Which Country Has the World's Best Healthcare. Thank you both for being here to have this conversation about vaccine passports. I'm going to start with you, Dr. Emanuel. From what I understand, you're in favor of vaccine passports. What is a vaccine passport, and why do you think it's a good idea?
First of all, separate whether I think it's a good idea or not good idea, it's here, it's coming, it's inevitable. Second, we use vaccine certification all the time for kids to go to school. I have my yellow fever certification to travel to certain countries. Other people have it. And I think we're going to need reassurance. For example, if I go into the hospital, I would like to know that people are actually vaccinated. I don't get sicker from going to the hospital than not. If I go to the theater, if I go to a sporting event. So you're going to have these things. What we have to make sure is that they're done ethically. I don't think it's a question of will we have it, won't we have it. We're going to have it, if only for international travel and probably domestic travel. And the question is to do it ethically, not whether to have it. That is the false discussion.
And one more question, Dr. Emanuel. So then what about the pushback from the right, as we saw in that montage of, this is Orwellian and the government is having all your information and they're tracking you? Should anyone have any concern about that?
Well, that's part of doing it ethically. I don't think we should have the government be looking into it and matching, vaccine passports with immigration or vaccine passports with taxation. I think that would be wrong. Similarly, I think it would be wrong if Google did it or Facebook did it and then commercialize it and, plug your information. I think all of those things are part of the safeguards we need and we have to have. And spending time, wasting time saying you're infringing my freedom. Look, you don't have a freedom to be infectious and spread it around society and endanger my life. That is false freedom. Remember, our founding fathers, they didn't talk about liberty, do whatever you want. They talked about ordered liberty. And part of ordered liberty is people actually doing things that protect their fellow citizens. And that is key that the Republican Party seems to have forgotten.
Laurie, you're sort of on the other side of this. You have a passport, but you don't think that they'll actually work. Talk about why. There it is on your cell phone there.
On my phone, Jonathan. And curiously, it says it expires on May 1st. So I have no idea what is the point of this idiotic thing. There's no place that allegedly I can show it. No foreign country recognizes the New York State QR code as proof that I've been vaccinated. It doesn't make a whole heck of a lot of sense to me. But, I'm old enough that I come from the era when I had one of these inside
I have one of those
passport. Too. And it has multiple vaccines, not one or two or three or four. It has pages of vaccines that have been administered in my lifetime. And I actually was thrown in a jail cell in one African country because this had fallen out of my passport and I didn't have it to show as I entered the country. These were very rigidly adhered to, but they were also easy to make fraudulently. As you can see, it's just paper.
Right.
Anybody with a printing press could make one of these things, and all sorts of people could pretend to be doctors and have these stamps to put in to say that you'd had vaccines. And so actually by the turn of the 21st century, most of the countries that were members of the World Health Assembly said, it's not working. We've got fake yellow fever passes all over Africa. We've got fake meningitis passes all over Africa and fake yellow cards all over the world. They've all been fraudulently administered. Let's get rid of this. Let's narrow it down. Let's focus on yellow fever and create the international health regulations. And so we stepped away from that entire approach because the truth was that, number one, it was overwhelmingly fraudulent. And number two, a lot of people were able to get around it based on their nationality when they crossed into a country. I, as a white person, got questioned less frequently than my co-travelers who were people of color. They were never administered fairly and justly. You were more likely to be denied entry to a country or thrown into jail if you were from some country that the place you were going to didn't like. And so I don't see the purpose of it. I certainly don't have any idea how between now and May 1st I'm going to use this darn thing.
So Lori, then, if they're fraudulent, they don't work, to Dr. Emanuel's point, how will people know whether it's safe to go into a hospital, go into a restaurant, or should we just live with COVID in the same way we live with the flu every year? Get the vaccine and hope for the best?
Look, what I find very curious about the right-wing assault is that there's this mistaken assumption that it's government that wants to do this, but actually it's employers. It's big business. It's a lot of places that want to put people in the seats. And they want some way of saying that I've safely put people in the seats and I can pack the seats. I can fill the auditorium. I can fill the office and so on. And so I think if there's likely to be inappropriate use or excessive use of some form of vaccine pass, it's really going to be more financially driven than anything to do with government watchdogs. And will it work? Well, we'll see. But I think that we have to be more adult about all of this. And I know Zeke would agree with me, because I've heard him say this many times before, that vaccination is not so much about you as it is about the community you live in. And if you're so selfish that you only identify with vaccination as self-protection and your right to move around freely, then you're missing the entire point. The point of vaccination is the total population. It's lowering the chance that everyone in America will get this disease. And if you can't all get on board, then we lose the game.
Dr. Emanuel, I'm giving you the last word real fast.
Yeah, Lori and I have heated agreement. These things are going to be there. The question is to make them good and to make them not about financial gain for big business. And there, I do think there's a role for government to make sure that we can actually use them and they're fair.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.